Good afternoon to you all. I am Dr Avinash Supe, a consultant surgeon at Zen Hospital, which is situated in Chembur. And today we are all going to talk about World Pancreatic Day. Now, all of you must have really heard that diabetes is increasing in our country, and Mumbai is going to be the diabetes capital in next few years. Similarly, we are seeing many cases of pancreatic cancer. Also, there is a lot of other diseases like acute pancreatitis, gallstone pancreatitis, which we will see around the world. So, what is this pancreas? We should understand pancreas is an organ which is not so commonly known in the people, but it is a large organ situated on the back side of the abdomen or behind the intestines, and it is from the right side to the left side towards the spleen. And what are the functions of pancreas? Pancreas has mainly 2-3 functions. One, it is an exocrine function. That means it secretes lot of enzymes which help our body to digest the food. And also, it secretes endocrine function like insulin, glucagon. Now, insulin is very important for controlling the blood sugar. And therefore, pancreas is a very important organ for all of us. And therefore, anything which happens to the pancreas is going to affect our body and lifestyle. So today, the World Pancreas Day, the theme is know it and how pancreas is, and making the awareness of the pancreas to everyone. So all of us should be aware of diabetes, how it can be prevented. All of us should be aware of how a pancreatic cancer can be decreased over a period of time. Now, diabetes is something which is a lifestyle disease. Though there are many genetic conditions in diabetes, most of the diabetes occurs because of lifestyle. Many people got diabetes during Corona, COVID-19, because all of them were sitting at home, eating, the exercise was not done, people used to eat a lot of sugar. So, the best solution to, as the age grows, there are 2 types of diabetes. Type 1 is a diabetes which happens in children, and type 2 diabetes which occurs in elderly people because of the insufficiency of the pancreatic enzyme. That means the pancreatic enzymes are less secreted than what is needed, and therefore patients come to you with uncontrolled blood sugar. And when the blood sugar gets uncontrolled, you will find that you get a lot of infections, you get a lot of other things. At the same time, you will find that people find heart disease, they got hemorrhages, stroke, all this is enhanced by diabetes. And therefore, diabetes prevention is so important today, and therefore taking care of your pancreas is very important. The second important thing you should all know about pancreas is that today the pancreatic cancers have increased. Also the net tumors, neuroendocrine tumor of pancreas. All of you know Steve Jobs. Steve Jobs died because of a neuroendocrine tumor of pancreas which got metastasized in liver, and then he had to undergo liver transplantation, which did not be successful, and then he lost. So today we see a lot of pancreatic cancers. Now, pancreatic cancers usually also occur in elderly people. Sometimes the factors like smoking, chronic pancreatitis, they can also affect or increase the incidence of pancreatic cancer. So we should really see that we should be aware of pancreas, functions of the pancreas. Another thing which is very common today, which has really increased today, is what is called as an acute pancreatitis. It's a very deadly disease. What is acute pancreatitis? Pancreatitis, when it gets swollen, it gets inflamed, it can cause havoc in our body. And it can happen because of excessive alcohol ingestion. It can occur in people who even don't drink. There also they can get acute pancreatitis, and this is because of the gallstone pancreatitis. What is gallstone pancreatitis? You know, all of us, that there is a gallbladder, ज्याला मराठीमध्ये आपण पित्ताशय म्हणतो. या gallbladder, there are small stones, or there is a sand. When that sand goes through the pancreas, the pancreatitis occurs. And that is the reason why people come out with a severe pain in the abdomen, and they are very uncomfortable. Some of them can die also because of acute pancreatitis. They get complete necrosis, that means the whole pancreas can get there are a lot of cells which die, and then they have to do again and again kind of surgeries. And these are the diseases which are now we see very commonly in last few years. So in last 20 years you will find there's an increase in the number of diabetic patients, there's an increase in number of acute pancreatitis, increase in the number of NET tumors or pancreatic cystic tumors, and also increase in number of pancreatic cancers. And because there is an increase in these, and the another thing which all of you should know about it, that in India today you will find there are about 30,000 new pancreatic cancers are detected every year. And the sad part of this is that many of these cancers are, more than 80% of cancers are diagnosed when they are very advanced. And there is not much of treatment which you can really do for them. Only 20% of tumors can be operated, and those who are operated require a very extensive, complicated surgery. And therefore you find that we must take care of pancreas. But I must tell you that there are now newer and newer techniques which are coming. Now we are doing these pancreatic surgeries through laparoscopy, where we make small multiple holes and we do it without making a big incision. Recently, even the robotics have come, and robotics has made life easy for deeper surgeries. So robotics is useful in various pelvic surgeries, esophageal surgeries, also the deeper surgeries like pancreatic surgery. So if we normally would like to operate these patients, these are the newer techniques of laparoscopy, minimal invasive surgery, endoscopic kind of surgeries, then retroperitoneal surgeries, robotic surgeries. These are the new tools which we are now trying to do at Zen Hospital, which will help you to treat these patients more effectively and more well during this particular period of time. Okay?
Alright, sir. Thank you so much. We'll take up few questions from the audience side, if any. Meanwhile, as you said, sir, diabetes is one of the factors wherein the cancers are increasing. Any other food intake that you think of?
See, what has happened today, we have been, if you see overall change in our life, two things have happened. One is we have been trying to rely more on various outside food because of the easy availability of that food. So when we eat outside, we eat more calories than what are needed. Secondly, we also eat more oil and sugar. Secondly, because of the all technology, OTT, TV, our exercise has gone down. And because of these two things, I feel we have been all those who are pre-diabetic, I mean those who are at the brink of getting diabetes because of either genetic history or overweight, or there are some pancreatic illnesses. These are the patients who get converted into diabetes very fast. And therefore what I would suggest is that those people, everybody should check their kind of weight, their food habits, especially I think you should cut down sugar as far as possible and do exercise at least 30 minutes. And if you do that, probably we'll be able to control the incidence of diabetes in our community.
Alright, sir. As you mentioned, pancreatic cancers usually towards the end when the stage is advanced, you come to know. Are there any early signs and symptoms that people can get to know?
Yes, there are sometimes. If the pancreas is a big organ. So usually if the pancreatic cancer is at the tip, then the early sign you will get is a mild jaundice, itching. You may get it if it's an ampullary cancer, or there may be slight bleeding which can happen. But if it is in the body, then you may get pain, or you may get back pain. Sometimes these are, as I said, get diagnosed in a late phase, but if you are little more doing these investigations, then you may be able to get it. So the early signs are you trying to do suspicion of all this and then try to get diagnosed. Regular methods of doing that.
Any specific tests, sir, that you're saying to get diagnosed for?
There are not many specific tests. Actually, the pancreas is situated so behind, so ultrasonology doesn't work well. But if you have, say, suspicion, family history, or people have pain, sudden loss of weight, then you should get a proper CT scan and other investigations to see whether he has that kind of suspicion.
Alright, sir. Does stress also contribute to increasing pancreatitis and cancer, sir?
Diabetes, yes, but not the cancer yet. There is not much of knowledge. Stress can induce diabetes, but it could be for a temporary period. Pancreatic cancer, probably there is not much of evidence to say that it is related to the stress. But smoking, yes, and gallstone sometimes long term, and that can really lead.
Alright, sir. If after removing pancreas totally, are there any side effects or is there any
Yes.
life after removing the pancreas?
Sure, very good question. See, normally what we do, we don't remove the full pancreas. Either we remove part of the pancreas or which is of the head or the tail side. But very rarely people may have to do remove the pancreas. So if you remove the pancreas, whether partially or totally, patients can get diabetes. So they get two things, exocrine deficiency and endocrine deficiency. Endocrine deficiency we get, some of them get diabetes if you remove the pancreas. And exocrine means what? Whatever you eat fat, it will not get digested well. So the patient will find large fluffy stools. And fat, whatever you eat, will come down without getting digested. So these are some of the effects of pancreatectomy. So then you may have to give some pancreatic supplements to them so that they can really do. So I think we have to all be aware that pancreas is a very organ. Till the time it is quiet, it is fine. Once it gets angry or it starts getting havoc, then it's one of the deadliest kind of a disease which you will face with. So we should be careful about these kind and take lifestyle care so that we don't go into all these diseases like acute pancreatitis and diabetes and all. So if you are able to control that, then we will be most happy. So today is a World Pancreatic Day, and I wish all of you a very healthy and very happy life in future.
Alright, so just the last question. You said it's a deadly cancer. So are there any survival rates after undergoing a...
Fine. Very nice question, Pooja. See, if the patients, a 5-year survival rate for advanced cancer are very low, less than 2% or something. But even if you operate these patients, the survival rates in ampullary cancers are good, but a regular cancer are not more than 15%, 5 to 15%. So this is a disease which once it happens, you can only control it, but if you catch it early and operate, then it has a good prognosis. But if you don't catch it early, then usually the patients don't survive more than 2-3 years.
Alright, sir. Thank you so much.
Thank you.